All right, I think we are live. I have here Dr. Kasia Kines, and she is author of the Epstein-Barr Virus Solution. And thank you so much. Thanks for, there we go. All right, always have your book handy. That's good. That's good.
Amazing, amazing.
Yeah. So how you doing today, Dr. Kasia?
I'm doing amazing. I'm doing amazing. I can't wait to hear what questions you have, support your community, do a little surgery on everybody's brains.
There you go.
About this big...
All right.
Thank
All
you
right.
so
Well,
much.
good deal.
Yeah.
Yeah, no, excited to have you, and I know there's been some excitements in my group, and I'm streaming it to my pages too. So, yeah, so why don't you start out just by just letting everyone know how you started helping people with Epstein-Barr, what motivated people, or what motivated you to write your book.
Okay, so I was the last person to even think I would write the book, and what happened was I just focused on it in my doctoral degree because of the story that I came to. So I kind of was forced to write it because I felt somebody has to do it. Somebody has to do it right. It just had to be done. And I have a hole in my heart. Okay, I have a hole in my heart because I lost a dear friend in Poland to MS. And long story short, I actually had a friend who is a medical intuitive. So one day I asked them, what do you think? Can you just tell me, why did she have MS? What happened to her? Because I couldn't help her. And she mentioned EBV, so I will never know, but I've always asked the question, and I've had my friend Marla and I in my dreams. I've had, it's just, I think she has a lot to do with the fact that I was able to stumble up on the right training, the right people, the right information, and somehow I was guided. I really think I'm just a messenger, and I miss her. I miss her, and I don't want her life to be in vain. It's nobody has to die, nobody has to suffer. So I just hone in on it, and I hone in on it, and I hone in, and I never let go. And so it's a little bit like you play piano, and you just love playing piano, and you play piano all the time, and before you know, you're a master of piano. It's just what happens. You just have to be single-minded and focus on it. And there's so much research. So that's what I did. I went after the research first. Yep, that's kind of the story. Mm-hmm.
No, that's great. So you mentioned MS, and of course, a lot of the viewers have Graves' disease and Hashimoto's. So can you talk a little bit about how Epstein-Barr plays a role just in those? And I mean, I guess you could talk about autoimmunity in general, or if you want to talk about thyroid autoimmunity.
Yeah, so, I have a laundry list of autoimmune disorders in my book. You probably remember table upon table of all kinds of illnesses. But Hashimoto's, we've had quite a number of cases of Hashimoto's, and we were able to reverse engineer it pretty fast too, just because we had confirmation of both Hashimoto's and EBV. And as you know, Hashimoto's can be triggered by a number of agents, and whether it's H. pylori, Yersinia, maybe gluten, but EBV is one of the biggest culprits. And so, thanks God that you test properly, but people are mistested. So they're not even tested properly for Hashimoto's. And we have an epidemic of low thyroid function in women, but actually mostly it may be Hashimoto's. So, you train your community that this is really necessary to test even properly for thyroid. So Graves is not as popular, or should I say common, in women, right? But it is there too. And I was surprised to see studies, and there's also in my book, that it can be, Graves can be, EBV can be a triggering point as well. And as you know, you can go from Graves to Hashimoto's. Not at the same time, but you can fluctuate, and we have stories of people. And just if autoimmunity is triggered by a virus, it could trickle. And then you can have another autoimmune disorder added after years, and another after years, because as you know, if you have one autoimmune disorder, you have a high likelihood of developing another over years. And with the way virus works when it's latent, when it continues to clone as B cells clone, that makes a lot of sense. So like it's not a waiting game with EBV, it's a ticking bomb. So the longer you go, the more damage and the more autoimmunity you can present. Now, with the story of MS, actually, on my bucket list is to meet in person Dr. Harley, just like the Harley Davidson, the bikes, Harley, the same spelling. Dr. Harley had a fabulous study just, I think it was 2 years ago or so, when he pointed specifically to EBV as a cause of 7 common autoimmune disorders, including celiac and MS, multiple sclerosis. The causating factor, celiac. Once I read that study, yes, I had a hunch about celiac. I was seeing some connections. There was another study in the past about association. But once I saw that study and I started to hone it, I started to see the pattern too. It can literally, the virus can go into, once the virus is in your infected cell, like B cell, it goes into the DNA of your cell, the nucleus, and creates an RNA and starts cloning itself. But it can also go into the DNA area that codes for immunity. And there's EBNA2, I think is the protein that can turn on those genes. So if you have celiac gene, but you really don't have celiac presenting, if that virus turns on that gene, suddenly you have celiac full blown, out of the blue. And you get so sick from eating wheat and gluten and you don't know what hit you.
Yeah.
Yeah, so it's a big elephant in the room, isn't it?
Yeah, no, definitely. And most people have Epstein-Barr, so it's potentially could be a problem with everybody. I don't know your perspective. Well, I guess I do because I did read the book, but even though it has been a little bit since I read it, but still, what I'm sure everybody else wants to know what you since Epstein-Barr. I guess the goal is not, at least my goal is not really to get rid of Epstein-Barr because, as far as I know, we can't get rid of the virus from your body. So what is your approach as far as when treating the virus?
Okay, so what came to mind is the story for some of our oldies. Maybe you remember Northern Exposure. There was this episode when a guy moved to Alaska because he has immune compromisation, and he builds a bubble and he kind of lives in that bubble, so he's safe. Well, the concept of getting rid of EBV is like trying to live in a bubble. It's impossible. It's a kissing disease. The virus has been on this planet for 1 million years. It's everywhere. You're gonna, maybe you may have contracted it through the womb when your mom was pregnant, no guilt. It's everywhere. 95% of the global population has had it. I probably have it, I haven't tested. I don't have a need to test because I know I know what I'm doing. So it's not going to take me down. I probably have antibodies, and most people have had infection and they don't even know it was mono, and especially if you were an infant and a child in the Western countries. So studies say it's like a little sniffle, it's not consequential, and so parents probably don't remember and you don't remember. So a lot of people with chronic EBV don't even remember having mono, which is like acute, whatever. So the point is, and I know people that are trying, and some of the viewers may be telling us, I'm taking monolaurin, I feel so bad, I'm trying to kill it, and this and that. You can kill as much as you want, but if you kill, the problem is not killing, like you said. The problem is turning it down and then turning it off, immobilizing it. Because it's like a makeup. It's with us. It's, we're on this journey together. And as terrible as it sounds, some of my students who have recovered, my clients who have recovered, the virus forced them to be more realistic, to say no, to prioritize, and then to follow their dreams, to leave corporate world or so, and they're making a huge difference in people's lives now just because they say it's been the biggest teacher. Because it's it's like a wake-up call. There's something that is not sustainable and it's hurting me. And the virus is predictable. It's like you can predict it. It just turns on and turns off and turns down. just depends on what happens. And so when I teach my students, they learn to understand what is the body speaking and what is the virus speaking. What is it? Well, how does it work? It's quite fascinating. It's a hard pill to swallow when you are so disabled and your life is stripped. You're on disability. You lost your job. You're depressed because you can't take care of your children, and then your spouse thinks it's in your head, and like you're not bleeding ulcers. They can't see it. It never goes away. It's like, come on, get a grip, get an antidepressant, or start exercising. You'll feel better. It's like, it's very hard, not only on doctors, but it's very hard on family and the loved ones. It's very hard to understand that. Yeah.
Yeah.
It's a tough situation to be in.
So is based on what you said, and especially you mentioned earlier, you yourself have not tested for Epstein-Barr because you know what to do, and meaning that it's more of an immune system problem than a virus problem. Is that safe to say? I mean, of course, the virus Epstein-Barr could be a problem, but
yeah, exactly. There's a tipping point, there's a bucket, there's like last straw that breaks the camel's back. And I had a little story with my left ear, so I didn't know it was viral. I think it's a herpes virus. I haven't tested what it is because I don't have to, because I know how to zap it. But I know at certain times, especially when there's a lot of stress, like especially when I launch my groups for my program, I'm so excited, but I'm so stressed out. I want it to be perfect. But I know what to do about it. And so that's what I teach my students. We can zap the reactivation of the viral thing. So there are what people forget. So let me bring that home, because what I see in the functional medicine community, I talk to doctors and acupuncturists and naturopathic doctors and MDs, and consistently what I see is they complain that they have partial results. So they try to piece maybe medication, like antiviral medication, maybe botanical, herbal medicine, maybe homeopathy, here. But what everybody's missing is that immune system requires nutrients. Like really, I'm a nutritionist and I'm so glad because it's a bigger shortcut. And when you look at medical research for EBV in particular, it's the nutrients that turn down the virus and turn it off. Selenium turns off its replication. Selenium. And so when you start honing on these, the herbal medicine, that's fine. That's adjunct. That's great. Herbal teas and tinctures are just fabulous. Would I ever rely on these? No. Would I get the results that I get? No. Because I'm going to tell you one thing. When you look at research, when your nutritional status drops, when you don't have the nutrients that you need, viral aggressiveness increases. The so-called virulence increases. If you have one crappy meal, like in a fast food joint, one crappy meal, increased NF-kappa B for 150% for 2.5 hours. And NF-kappa B is an inflammatory marker. It's like a protein. And the virus uses that to replicate. So you boosted up the viruses more to replicate. One meal. And so we can have profound effect just cleaning our kitchen, making our kitchen beautiful, healing. And pretty much what I've been doing in my life has been antiviral. I had no idea until I stumbled upon this virus. So it was really easy for me to write the book and easy to create protocols and see results. And that's why I'm thinking I'm just the messenger, because my work over the 1.5 decades was so aligned with the virus, and I had no idea. So I think like the universe was, just training me. So everything came to this point, and then medical medium book, I had to read it because my clients were asking me, it's like, okay, can I verify? Huh?
No, I said same here. They kept on bringing up medical medium, and I'm like, okay, I guess I have to read medical medium.
I guess I have to read it. Yes, I guess. So I read it on the plane to the conference because I didn't have time to read. It's like, okay, I have nowhere to go. I'll read it. But I almost fell off my chair because I'm thinking, well, I know exactly which person in my clinic was this, and this is this, and this is this, this is this. These are my people. These are my clients. So, you know, I was thinking, what if half of it is true? You know, medical doctors may really be not quite open-minded. Not everybody, you know, spiritually, everybody has different sensitivities, and sensibilities. But how do I bring this information, verify it? What if half of it is true? What about this? What about this? What about this? So that, I felt that was my job. Take that information and see, jump into PubMed and just jump into medical literature. What do we know about this virus actually? And so that's how I got started, and I just never looked back, because it was an ocean of research, let me tell you. And doctors don't know because they don't look, they don't have time.
Yeah. And that's one thing I wanted to point out. I know you're supportive of, you know, Anthony William, you know, as far as his book goes, but the difference, like a lot of people will ask, what's the difference between your book and Medical Medium, and yours is, like, as you mentioned, you just dove into the research. You've done a lot of research, so just more scientific. So.
Yes, you know, he opened the door. He opened the door to the conversation. Like for me, oh, this is why we hit the wall, like you and I, and we're not getting forward, and there's no training. Nobody teaches you, you know, we need that. And thanks God for Dr. Vasquez, because in my doctoral program, he actually trained me in virology. It's like, I see. And, but you know, with Medical Medium, that's his job. But it's a blanket statement. Everything, you know, this will work for everyone. This is what you have to do. This is what you have to do. And he's not a nutritionist. So I love the concept of food and plant-based foods. I love the recipes. I find some of the recipes, if I try them, I have to tweak them to really make them delicious. Really. So, but they're plants, and we need those plants. They have so much to offer. At the same time, sometimes people that have been applying this, you know, people don't have nutritional background. They don't know how to balance meals and how to prevent deficiency and how to not overdo certain things to the detriment. You know, sometimes celery juice is not tolerated, and sometimes makes people sick. You know, so sometimes they have to do a little bit of repair and train people on basics of nutritional sustainability. What does it mean to have a sustainable meal? What does it mean to have a nice breakfast or lunch or dinner or snack? How do you balance them? What does it mean for the brain, for your sleep, you know? So that's my training. Thanks God, I'm in such a good position because we're bringing all this together. So, you know, Medical Medium is fascinating because it's just throwing the issue out there, and now even medical doctors have to deal with it. You know, my patients are asking me to test this darn EBV. What is this? Is this a fashion now? Everybody has it. People go and say, I think I have EBV. Can you please test me?
Yeah. Speaking of the testing, so can we talk a little bit about the blood testing?
Anything you want.
Yeah. So what do you look for? Typically in the past, we would look for, you know, IgM, as in Mary. Those antibodies would indicate someone has active Epstein-Barr virus, and then there are 3 IgG markers. And so so how do you, I mean, in a minute or two, I know it probably would take longer to really go into detail, but if you could quickly say how you look at those and how you look at those tests, how you interpret those tests.
Yeah, so first of all, if you're going to ask a doctor for testing, you want to ask them for 4 antibodies, like you mentioned, 4, not 3, 4. And sometimes they just go by the lab, and the lab does 3. No, 4. Go back, insist. Be your best advocate. Do not settle on 3, because you're not going to know. So the IgG, IgM is not exactly correct. The only IgM in those 4, that typically is elevated if it's your first go. If it's your first infection. Now, it should spike when you have reactivation, but that's not what we see. It doesn't show enough. So I've had very few cases over the years when people say, I constantly have this IgM elevated. That's pretty bad. So that is expected to be normal, actually. The other 3 is what you're looking at. Now, of these three, the most important is the early antigen. Early antigen. Early antigen. Repeat, everyone. Early antigen.
Early antigen.
Early antigen is the one that spikes with your reactivations. This is the one that will show up again and again. And I'm going to tell you a story because people get confused, and this will clarify it. I had a clinician group, and we were going over cases, and one of my students said, well, I have a classic EBV. I know it is what it is. But she tested, and her early antigen is normal. The other ones are, the two are elevated, the IgM is normal. But this is normal. What do I do with this? And it's like, okay, when did she test? January. Okay. When did she feel like she was hit by the truck? Thanksgiving. You take 4 weeks or so, early antigen will start dropping and normalizing. So it's like, when do you test? So if people are testing first time, or they're confused, or they have all these tests and they don't know how to read them, next time you feel really the worst, that's where you test. So let me show you here. I have this, where is my little card here? Here we go. I show these because this is easy to show. So, if you have EBV, you should be like right here if you're healthy, but you have symptoms, more or less. Your reactivation is like, and then maybe better and worse and better. So you want to test when you're right there. If you test a few weeks further, your early antigen will no longer show. And so you want to do it a few times to see if you want to test between reactivations, test it then so you can see how, the values change. But for me, as they say, good doctors don't work with labs, they work with people, right? So for me, the trajectory and timeline is very important. Are you responding to medical therapies? Are you responding to any other therapies as expected? Or is your clinician doctor, banging their head against the wall like I did? What is it that I'm doing wrong? We should have a response. In medical literature, these cases are suspected EBV, chronic EBV. That's what medical literature says. So I'm looking at the history. Are you getting better? Are you getting all these conditions? Or multiple conditions? So that's important, So when I start with a new client, for example, the homework before the first session for them is try to read the book, but don't get stuck on science or details. Just read it. Read it with the eyes on the virus, how it thinks through your life, because they pinpoint situations and times in their lives. Oh my gosh, I had juvenile rheumatoid arthritis, idiopathic one. Nobody knew why. Oh my gosh, after that in college, I think that was mono. Now I understand. I was so sick during exams, and this and this and this and this. So that's where you start piecing together a case that EBV may be the big elephant behind all these tentacles, individual illnesses and symptoms.
Okay. Do you also look at obviously the Epstein-Barr virus testing, as you just mentioned, probably the most relevant, but as far as the complete blood count with differential, do you pay attention to neutrophils and lymphocytes? If the lymphocytes are higher than neutrophils, or even do you?
No, people have odd presentations, and sometimes they're, platelets. Low platelets for me are bigger. If you have low white blood cells, oftentimes it's with viral infections, but it's also with molds maybe, or the reasons may be various. So when sometimes the immunity is really down, I often look more at co-infections if things do not respond, because sometimes people have H. pylori, strep, SIBO, all kinds of stuff. There's this concept of transactivation. When you have EBV, you can reactivate other pathogens that are different species. And when you have a different pathogens like H. pylori, it can also reactivate EBV. So it's like a big party, cross species at your expense. That's very well documented in medical literature. There's a specific mechanism within your B cells. But yeah, so for me, these are more relevant,
How about other viruses like cytomegalovirus or herpes simplex? Do you
Yeah, I said absolutely.
When you said co-infections, I didn't know if I know you specifically mentioned H. pylori and Lyme. A lot of people with Lyme. There's the Lyme and Epstein-Barr.
Yeah, I mean, if people can do a good stool test, that's helpful, because sometimes the immune compromisation stems from problems within your stomach integrity, within your gut, because gut is most of your immunity. So if we can target the gut and see what's going on in the gut, why is it not working? Where is it? What's leaking and what's causing it? Sometimes the EBV is in the gut and causing problems. But there's a lot that you can learn from a good stool test, including immunity, like secretory IgA and elastase 1, if your pancreatic enzymes are actually secreted. And then you can go deeper into hydrochloric acid secretion. That's a big problem. Whether people have even pernicious anemia, they don't know, or H. pylori infection, they don't know. It all has trickling effect on the immune system. It compromises you, and as a result, EBV can just continue and spiral. So, yep.
All right. Well, I know you have a call at 5, so I want to make sure we have some time for questions. And I promise that you'd be wrap things up around 1:45 to give you more time. So let's see what questions people have, and so if someone did ask again, what's the name of your book? And that is hold it up, the Epstein-Barr Virus Solution. And I assume would the best place be Amazon to?
Yes.
Okay. All right. If anybody has questions, definitely post them and I'll answer. While waiting for questions to come in, just another question with the diet. So of course, I agree with you. Nutrients, you want to eat a nutrient-dense diet, and it's, a lot of people overlook nutrient deficiencies, but of course, even a single nutrient deficiency can cause problems. But that being said, sometimes you do need to supplement, correct? Like, as much as you want to do everything through diet, there is a time and place for supplement, correct? For supplementation.
Yes. And so the challenge with supplements is that people can take 20 supplements, and, you have to have the right quality, the right dose, the right combination, the right timing of it. Some things have to be with food or without food, morning, evening. And the dosage in particular, you can be taking the same supplements, but if I tweak the doses for you, magic will start to happen. And the dosages are based on literature, and also I hone on them in my clinical practice, when they really, the supplements can make the biggest impact the fastest, actually. And sometimes, when we expect people to, if you have EBV, you have to change your diet, you have to this, you have to this, you have to this. They have so much brain fog and so much fatigue, they can't cook. Forget about going into a store and shopping. Some people get so fatigued after a trip to the shop, they can't do it. So I have to teach them how to get delivery, or how to get meals, or, first supplements to build you up so you can have a little bit of more focus, less pain, and less of this fatigue, and suddenly you can think better and you can maybe cook a little bit. So I think supplements are sometimes heaven sent to people, the right ones. But I also see a lot of waste of time and money on them. And it's not hard. You just need to know. It's like we really need to hone on it. And then it's like we hit the virus.
All right. Yeah, we actually have a few in the comments, a few questions on supplements. So one person asked, how much selenium should you supplement?
Right on. So if you look at medical literature, and my feedback is consistent in my clinic, up to 800 micrograms. If you are well-built and big person, if you are petite, I would say 600. And, it comes in 200 microgram increments, so 3 to 4 capsules. If you take a full 4 capsule dose, you have to be careful. So I teach people to, what are the side effects of overdoing it, what to pay attention to. It's pretty straightforward. And And then you can always start with 200, 400, 600 and stop at 600. That's very safe. Above 800, you can have toxicity level, and that's not good. So you want to make sure that you look at all your supplements.
Mm-hmm.
Make sure that there's no selenium added here or there, because you may, that can tip you over. And that's at least 600, especially, is safe long term. And that's actually, I think you wanted to ask me a question, which 3 supplements I would like, and selenium is one of them. Absolutely, hands down. It does so much, and especially for your community with thyroid. Selenium for thyroid, that's a no-brainer.
Yeah, and I commonly get, a lot of practitioners like myself give 200 micrograms, and we're nervous about going too high, but we had this conversation the other day, so I already knew the answer to the question, because you said that you commonly give 600 to 800 micrograms. And it depends on the person. If they're more petite, maybe closer to the 600. And like you said, just make sure that there's no other sources of selenium. Which, speaking of, Jenny, I'll get to your question in a minute, but someone else asked a good question about Brazil nuts. Good.
Of course.
I read that Brazil nuts are good for selenium was the comment. So can they just? I think I know the answer. I haven't asked you this, but I guess my answer is it varies, because you never know what's in a single Brazil nut, and the soil could differ. So it could be anywhere from like 10, 20 micrograms to, and it could be like 70, 80 micrograms, but probably with the soil and all that, unless you're getting a good quality organic Brazil nut, it probably is closer to the 10, 20 microgram per nut.
Yeah, so that's exactly the point, Dr. Eric. The problem is when you have EBV, you don't gamble with your health. You want to have predictable results. You want to know exactly what you're eating. And so, that's exactly the point. You don't know what you're getting. You get a lot of oysters. You don't know what you get. You will get a lot of heavy metals, probably with oysters too. So, the predictability is important. Learning, how do you feel on 200? How do you feel on 400? How do you feel on 600? Can you maintain 600 long term and be okay with it? Thanks God for Dr. Vasquez, because this was one of the aha moments for me when he trained me about that. It's like, I never thought about it. So, it's not my idea. I can't take credit for it. I just learn and apply. And so yes, that I can make a big difference even with Hashimoto's single-handedly too. Yeah. And so many things that selenium does. So many.
Yeah. No, that's great. What was that? Is that Dr. Alex Vasquez, by the way, or? Yeah, okay. Just because he was, when I went through my master's in nutrition, he was one of the instructors, and I've read his virus book. Just a
100-page book. Yeah.
Yeah. So, okay. Now, supplements. Someone else asked, what are the best anti-inflammatory supplements for our health? So, I guess besides, selenium, I think you, in your book, I know you talk about curcumin, for example. I don't know if you would list that as one of the top supplements, but I guess as far as supplements for inflammation, anything besides curcumin, or?
Yeah, bioavailable curcumin, not just regular curcumin, because it's not that bioavailable, but there are forms that are better. Omega-3, absolutely, hands down. In my clinic, I use something called OPC3, and that's a little bit like red wine on steroids, an isotonic solution of different OPCs. So it's the purple constituents like the wild blueberries and red wine extract and pycnogenol, resveratrol. All these are antiviral and also anti-inflammatory. But the biggest anti-inflammatory aspect is kitchen herbs, culinary herbs, lots of them, and diet. Because diet is pro-inflammatory or anti-inflammatory. Every time you open your mouth, you have that choice. Just like I talked about the NF-kappa B and a crappy meal and a fast food.
Yeah.
Inflammation in the making, right? So bad oils, inflammation in the making. Animal protein, animal, cheeses and dairy, inflammation in the making. Red meat, inflammation in the making. So very simple things that sometimes it's hard to get off these. So we nutritionists have all the kits. So if I train people in the program, they have all the tools so they can transition and learn how to do things properly, more with plans. So yeah.
All right. Thank you for that response. And then let's see. So Frank and Annette here says, I have Hashimoto's. I have extremely high EBV antibodies. my doctor has been trying to address the EBV with the the antiviral, valacyclovir, but it's not helping. So yeah.
Yeah. So when I was studying medical literature, I saw consistently in studies that the antiviral medications don't have very good efficacy. And so, when you actually learn about EBV and what it does and how it thinks, medication can be a solution because it's a band-aid. When you actually have the capacity, and it's in your hands, literally, you have capacity to turn down the virus here and there, to turn it off. You have power in your hands. You can really modulate this virus. It's very empowering. You don't have to have any medications. So it's unfortunate. I'm glad that the doctor's recognizing and that you actually have both tests done. That's beautiful, because sometimes it takes years for people to actually have both tests done. So that's the tragic element of where we are. But if you had that done, what would I recommend? Read the book, talk to Dr. Eric, get a bigger team. We have a program for people that are ill. We have everything lined up. We have everything. We get people to get their lives back. I'm so excited about it.
Yeah, and someone asked, which, speaking of your book, so someone said, is it possible to post the nutrients? Hard to pretty much get the book. I mean, get the book. And as you mentioned, you also have a program, but I mean, her book is amazing. I'm not just saying that because the reason she's here is because her book is amazing. It's, I'm not saying that her book's amazing because she's here. I wouldn't be interviewing her. So definitely get her Epstein-Barr Virus Solution book. And very thick book. And again, it lists the nutrients. It lists, certain herbs. Of course, it goes into diet. It's not just about taking supplements, as we mentioned. And then also she has, Dr. Kasia has a webinar, a free webinar. So I will put that in where I'm using StreamYard here. So I don't know if I put it here, if it'll transfer. So what I'm going to do, just to play it safe, is after this is over, I'll go into my group and the 2 pages, and I'll put the link in case for those to watch the free webinar. But so watch the free webinar, and then also definitely get her book. And with the antivirals, I don't see them commonly recommended for Epstein-Barr. I do see them for like shingles, when someone has herpes zoster, but I can't say for Epstein-Barr. I see doctors.
Yeah, and it's a tough one. I'm very excited about this webinar because we actually, what I like to talk about is the autoimmunity, exactly how it works. But also we talk about what happens with the virus between reactivations, because it's not sitting there latently, actually. So my goal for the webinar is to teach people to know more than the doctors know. So once you operate on your brains, you guys, once you have a new concept of what the virus actually does and how it's a ticking bomb, how, what to expect and what you can do about it. So that alone is life-changing. So yes, if you can watch that, we have 2 more coming up. I just love delivering it. I just love the lights on and people asking questions like, oh my gosh, I had no idea.
Yeah, and while the book is great, and I definitely recommend reading it, obviously it'll take time to go through the book, whereas, the webinar, I guess, is about an hour or so, or...
Well, I practiced yesterday and I kept it under an hour, but today it was 1 hour, 45 minutes.
Oh, wow. Okay. So.
Just so engaging and, great questions at the end. And it's a tough virus, but once you understand it, I like to deflate the anxiety and the fear. It's like, oh my gosh, it's so big. What do I know? It's not so big. It's not so overwhelming. It's predictable, and Dr. Flavin proves it can be reversed. It can be treatable. We need that information, and then we need inspiration, and then we need to get dirty and get in there and get that virus under control so you can live your life. I just can't stand people being in pain. As I said, I have the hole in my heart. It will always be there, and my heart is filled when I can see one person turn around, because I always think that's the person, you know, instead of Marlena, that I can help. I don't think it's likely. So the program is really, really top notch. I made sure that it serves beautifully. Mm.
All right. Now we'll definitely make sure that they get access to the webinar. And we did have a question here about flaxseed oil. For someone asked. So someone asked. Well, there's two questions. So one person asked, is flaxseed oil a good substitute for fish oil, omega-3, dealing with Graves and don't want to include more iodine? And then Jenny asked about fish oil. So I think we'd agree fish oil is fine. But I recommend, well, I guess I'll get your perspective on fish oil. I mean, I commonly recommend fish oil to my Graves' disease and Hashimoto's patients. So, I don't see really a negative, any problems with fish oil, but yeah, I'd love to hear, I'm sure they would love to hear what you have to say.
Yeah, of course. Well, flaxseed is wonderful, especially for hormones, for women. And as long as you keep it cold and not heated. It doesn't take care of some of the constituents of the essential oils, only some of them. So the full makeup of essential oils for your brain, for your inflammation, for your cells, every single cell, by the way, requires this fat, is omega-3 from fish oil. But if you want to be vegan right now, we have technology to use, krill, sometimes krill oil people use, but I don't think it's that effective. But if you want to go plant-based, you can get omega-3, EPA, DHA from algae, because
algae oil, yeah.
And we eat fish and so on. So you go to the bottom of the food chain, and you make sure that you keep these oils, flaxseed oil, omega-3 oils, in the fridge, because they oxidize very fast. Now, if some people today say, whoops, I had no idea, nobody told me, it's not on the bottle. Take a needle, go to the sink, take one capsule, open it, and then smell it and taste it. If it's fishy fresh, good. If it's fishy, lousy, rancid, discard it.
Yep.
Easy.
Yep. Good advice, yeah. Yeah, and the quality is important. I usually don't recommend just like getting like a year supply of fish oil, like going to Costco and just getting, just to save money. I mean,
No.
I mean, you don't want to do that with any supplement, but especially fish oils, it could actually do more harm than good if you're eating rancid oils. I mean, if you're consuming rancid fish oils. So.
Same thing with olive oil, exactly. Small, one at a time. And, you have to go to a clinician, go to practitioner, go to doctor like Dr. Eric, who has dispensary, who knows exactly which brands are clean, have mercury distilled molecularly, the right doses. You can take a crappy omega-3 and get sicker from it. It's a big industry, and there's a lot of junk. So never go on eBay, Amazon. Do not go there, because you may not be getting what you think. And for all you know, the person that's selling you so cheap may have kept it in their trunk in Arizona in full sun for half a year. It's completely rancid.
Yeah, that is true. That's true. Yeah. I know you have to go, so I want, again, I want to respect your time, but maybe we could have you back, one day for a future follow-up and Q&A.
Dr. Eric, I love what you do, and especially, Hashimoto's and thyroid, that's already a big acknowledged thing. A lot of clinicians work with it, but Graves, that's under the radar. That's harder, so thanks God for you.
Well, thank you, and same with you, Dr. Kines. Thankfully, we have you to also help out with, those in need for, suffering with the Epstein. I mean, again, most people have Epstein-Barr, but, a lot of people don't realize how big of a problem it is. So, definitely, again, pick up a copy of, Dr. Kasia Kines' book, The Epstein-Barr Virus Solution. You get the physical copy. I try to get physical copies, but honestly, with yours, I wanted to get it. When I saw it, I'm like, I need to get it. So I got the Kindle version just because I don't want to wait for the copy, so I need to. But
you were lucky. We had to drop the Kindle because it was not compatible. We tried to reinstall it 3 times, so we had to drop it. But I've been just talking to my team and my advisors, and there's a way for us to actually make it available on our website in PDF. So we're going to. Yes, we have something.
Yeah, I'm sorry. I was going to say I was able to, I guess because I purchased it in the past, I was able to, I couldn't access it on like the, I don't have an actual Kindle. So I would use like the cloud reader. My wife has a Kindle, but I try to read physical books when I do. But what yours, like I said, I got, I was like, I got to get this and I don't want to wait for the book, but I couldn't access it on the cloud reader, but I was able to access it on the Kindle app on my computer. I guess because I already purchased it, but I guess, yeah, I didn't even realize it's not, for now, not available as a.
You're so smart. Yeah, well, Kindle was not helpful. We tried 3 times and we have so many complaints from the people with whose Kindle it was not compatible. It was just only one version, but we had 1-star reviews, very upset people. And
wow, yeah.
And Amazon didn't want to remove those 1 stars and we couldn't figure it out. So I said we had to just shelve it. So I was really upset about that, but this is like for fall, this is my biggest project to actually make it available in PDF. So I am totally excited because we have so many requests over the years. So yes, it's coming.
Right. Well, for now, if you can't wait for that, again, go to Amazon and it's definitely worth the physical copy, in my opinion. Get that physical copy, or again, you can wait for the PDF. Either way, attend her webinar. And again, I will send a link. I'll include a link in my group and 2 pages. But again, thank you so much, Dr. Kasia. Appreciate you I appreciate you joining us, I should say. And thank you for answering the questions, and look forward to having you again in the future.
Thank you so much. Anytime, really, it's my honor. And keep doing your work. Keep doing your work. We need you.
All right, same here. You take care. Have a great day and weekends, and good luck with your 5 o'clock call.
Thank you. And good luck to you all, you guys.
All right, thanks, Doc.